So today we're going to talk about how to do back traction at home with very little equipment. Actually, equipment that's very inexpensive, and you probably have this at home. We're also going to get into when this is going to be successful for you. What does it look like? What are the possible symptoms that you're getting in your body that this exercise will work for you? Hi, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications while getting their life back. Often clients have gone to 7, 8, 9 different healthcare providers before coming to us and not getting results with them, but getting results with us. We often say where the side of the pain is often not where the source of the problem is coming from. And this case that we're going to talk about today is that very same thing that's going to happen. So what happens when someone when an exercise like this is going to help someone? So when we look at this, typically what we find in our clients is the pain will almost go into that SI joint. So it's almost kind of coming through here, through that back part through here. They may not have a lot of back pain. Maybe it's like back stiffness, but the pain actually is coming kind of almost in that SI part, or it comes down into the hip, down and through here. They'll make complaints like even lifting their leg up gives them a lot of problems. And so when we start talking to people, it may seem like this actually is a hip issue, but in reality, it's a back issue. And again, like where we look at where the side of the pain is, because they're not having, they might have some back stiffness, but they're not really having, most of their pain's actually in their hip. So most people go straight to the hip going, okay, we need to address the hip, when in reality, it's a back issue. So what's happening? So a lot of times when this exercise is going to work, it's when that lowest level is kind of herniated. So the lowest level on the pelvis, here's the pelvis, is the level that's just above this. And the reason why is because when we stand, we have a normal posture through here that has just a little bit of a curve. But when we go and sit, we tend to sit slouched. And even when you just slouch just a little bit, that lowest level is the one that's getting hit the most. And the more that you slouch, the more that you're putting pressure on that lowest level. So it tends to be a problem on a lot of people just because of our everyday activities. The way I like to describe it, it's kind of like if you pull your finger back and you hold your finger back like this 8 hours a day, day after day. The joint doesn't like being in this position. You come out of it, takes time for it to recover, but then we go back into it the next day. And eventually over time, it could take months, it could take years. Eventually the joints don't like being in this position, and all of a sudden you're like, I start hurting, I don't know what I did, and you're like, what's going on? And it's just because of the positions and postures that you've been in, more than likely is what's causing a lot of your pain. So when we have clients that come in and they start talking about symptoms that are a little bit more in their hip, and they may have some back stiffness, but the majority of their pain is actually in their hip, this is a great exercise to do that you can do at home that's going to give you a little bit of traction. Now, at our office, we're always taking baselines. So we're wanting to look at the baselines. How do they move forward? Forward meaning bending forward like this. How are we moving backwards in our back? How are we moving side to side? And we go in and see kind of how they're moving so that we can get some baselines like, oh, it kind of bothers them going forward. They don't have as much range of motion going forward. They might not have as much range of motion going backwards. Typically when traction works, going side to side isn't going to be a problem. But their hip, typically on the side that is hurting, also is limited. It's limited in being able to bend it. It hurts doing this. It's limited in bringing the leg back. It'll also potentially be limited with rotation. So rotation like this may also be limited, but it's coming from the back. It's not the hip that's the problem. But those are different baselines that we look at when we go and do this exercise, and we go back through those baselines again to see if there's some improvement. So how are you going to get the traction? So you're going to literally lie on your back. You're going to have the foam roller, and you're just going to kind of roll onto the foam roller. We want the foam roller to be kind of at the base of like your pelvis where the SI joint is. Essentially, your knees are going to be bent. Then what you're going to do is you're going to literally roll down a little bit so that the pelvis is, your bottom is like going towards the ground. You're not going to touch the ground. You're just going to roll so you get that part of the body is kind of giving you, going with gravity to give you a little bit of traction. You're also having where the foam roller is where you're giving a little bit of pressure into that back. Actually feels really good.
And then you're just gonna hang out here for a minute. And what this is doing is it's just opening up that space while giving us a little bit of overpressure, and it'll feel really good. It's just getting things to move that have gotten us a little stiff, because we're always moving in that bent forward position, kind of slouching when we sit. We're always bending forward to pick things up. So we want to take the body in the opposite direction to kind of open up that joint to make it less stiff, essentially. So you'll hang out here for about a minute. Usually what we prescribe patients is to hang out there, do it every couple of hours, but definitely get it 2 to 3 times in throughout the day. Now, if you're noticing that your symptoms are getting a little bit worse, the pain is starting to go down the leg, then you need to make sure you get to someone to go reassess to make sure like what you're doing is the correct thing for you. Because like I said, there's other directions that we can go into, that we need to go into. And it's not just this direction that's going to make everyone feel really good. Sometimes it could be issues in the hip. Sometimes we could be doing things where we need to go in a different direction to really open up that joint. But this one works for probably 70% of the people. This is going to be a good one for you to do. So the other thing that happens too, if you've hung out here for about a minute or so, your joints aren't used to moving in that direction, and you can get really stiff coming out of it. So you may not be able to lift up and bridge. Very common, that can happen. So how you're gonna get off this is you just kind of roll forward, and then you'll kind of come up. Now, if you took some baselines for yourself, like you bent forward, you went backwards, you kind of looked at your hip range of motion, go in and retest those. And if those have gotten better, then we know that this is going to be a great exercise for you. You may be a little stiff, like if you've been moving into extension, the first time that you bend forward, you may be a little bit stiff. Go ahead and do it again, and you may notice that you're able to go down a little bit farther. Again, those are great signs that this is going to be a great exercise for you. Again, make sure that you subscribe to our channel because we're putting content out all the time. And go into the description. We have other videos and resources for you there specific around this area so that you can continue your learning to help you navigate the healthcare system for what's going on with you a little bit better. That's really our goal. Our goal is to maybe have you think of the body in a little bit of a different way, that you can take this information, have someone that you're going to look at you a little bit closer to figure out what's going on with you.